we're straight. Hey you guys, welcome back to my channel. If you're new or if you followed me for a while, hello and welcome back. So today we're going to talk about a couple things that I wish were on the internet, and that's really just about tamoxifen. Why I fear it, my cancer story, does tamoxifen get worse over time, side effects, as well as any advice that I have for you. So if you're interested and if you are just so fearful of this drug and just want as much information as you can from other women sharing their story, just keep watching. Okay, well, first of all, hey guys, how are we doing? If you follow me because of my cancer journey, or if you've never seen my face before, that's totally fine. I have a whole playlist. I'm gonna do a tiny recap. So in January, I found out that I had DCIS. I ended up going to MD Anderson in Houston, and I ended up having to have a single mastectomy, a uni mastectomy, I don't know. You know, I had a couple surgeries. Again, all the videos are going to be linked there. Before I saw my oncologist, before my last surgery, she said that I would be taking tamoxifen, and I was so scared because once I first found out that I had cancer, tamoxifen was the first thing that I had seen on like everything that said like, this is horrible, it like really messed up my body, I'm so scared of it. And along with all of the other things that you see on the internet, that could possibly be your story, like a mastectomy, you just start to feel overwhelmed, especially if you haven't even got to your first appointment, which I totally understand. I knew after hearing also a lot of videos and podcasts about people talking about tamoxifen, I knew that that's what I did not want to take. Unfortunately, that's all I could take because I didn't have a double mastectomy, apparently, according to my oncologist. Anyway, to sum that all up, that was that. It's gonna be 2 months of taking tamoxifen after next week, so once this video is live, basically. And I just want to share my experience. I honestly put it off so long. I was so scared that my oncologist would also be like, hey, I told you to start taking it now. But I did check in with her, and she's like, whenever you feel like you're ready. I did wait until I was back home, had a little, like I was back at work, had a little, like was working out too, and had a little bit of a routine because I feel like that's so important after a cancer diagnosis. So let's start with my fear of taking it, and I'll talk a little bit about my oncologist. So I actually have my notes here, so sorry, I keep looking there. I've touched up on my fear so far, like basically I was scared, it was something that I didn't want to take. You learn all these side effects, and I think it also is important that I quickly look up. When I was going through cancer, I was making videos, everything was fresh in my mind. I totally forgot the definition. It blocks estrogen, so like your body reacts like you're on menopause. Basically, it blocks the effects of estrogen, or it blocks estrogen. In exchange, we get all of these menopausal symptoms. And the list goes on and on. Like, it's scary. Like, it's some scary stuff that's on that list. And I had so many fears, like, which I will talk about, like weight gain and just like forgetting everything. And well, weight gain honestly was like a big one. I'm sure some of you guys could relate to that. And just like pain and feeling like a 50-year-old's body in a 24-year-old's body, because that's my age. And I remember when I saw my oncologist, I was so sure I did not want to take it, and she ended up telling me that that was my only option. And I still remember clear as day not really liking my oncologist. Like, if you've been to MD Anderson, all of your team is going to be wonderful for the most part. I've had some negative experiences, but it's really like rare. My oncologist definitely wasn't someone that I felt, I don't know, like her responses to things, and it was just like very matter of fact, and really didn't really tell me too much about, didn't really explain too much. And the only way I could explain it, she felt like a little cold. When I would ask her like, is this the only thing I can take, she'd be like, yes. And it's like, okay, so like why? You know what I mean? And I felt like she was a little insensitive when I was getting to the conclusion that if I had had a double mastectomy, as we were talking, would I still be taking tamoxifen? She had said something along the lines of, you know, that's actually something that we don't recommend 24-year-olds to do. That was like the longest response that she had actually given me. That seemed like a little with more emotion, I guess. It's not like I want to have a double mastectomy. but she was basically saying like we won't let you do that. And again, very cold. So I don't know, you basically see your oncologist more than anyone after your, you know, diagnosis. But a lot of people say that they love their oncologist, so probably you will too. I just didn't like mine. Maybe just personal, but I really just didn't. Anyway, to wrap that up, I do also want to add in, so I'm so scared. I wrote down a whole list of things that I wanted her to talk about, like, what about this side effect? Can you tell me about this? Tell me da 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 da. I had so many questions for all my doctors actually. I did ask her, what do you generally hear from specifically young people when taking this drug? Like, what's the common issue, or I don't know how to phrase that right now, but you know, what's a common complaint that you hear young people say about this medication? How are they reacting to this drug? Of course, there's some cases where it varies, but for the most part, the younger people tend to do the best on the drug. And I'm 20, but even in the Facebook groups that I'm at some of the 30-year-olds are also doing pretty well. I do want to say I'm so early in things. Of course, your body could change, but we'll talk about that a little bit later. Hopefully this is informational for all ages, but I do think like there's not that much AYA, so young people with cancer talking and going on tamoxifen on the internet talking about this subject. So I really thought it was so important that I posted this video. So again, sorry if I'm excluding people that are older. If you are young or any age, it's so helpful if you leave a comment below talking about your experience and is it really as bad as people make it out to be. Let's talk about side effects. So I listed a couple things and I'm just gonna go through them. These are side effects and these are short term technically. Like these are like physical that you notice right away versus like long-term effects like blood clots and a thicker lining in your uterus. Like those things are scary still, but some stuff that you don't pick up at first, right? So 2 months in, what am I experiencing? So for the hot flashes, after I started taking it, I started to try to pay attention, and it just had become summer and I was working, and I work in sometimes in a fast-paced setting, or for the most part it is actually fast-paced, so I couldn't really tell if it was hot flashes or not. I would experience like kind of mini ones. I don't know if this is it. Like I would just get hot every now and then, but like I would wear a sweater and then I don't know. Like, do you guys experience like all of a sudden you get cold and then all of a sudden you get hot? So I don't know if it's linked to tamoxifen. Either way, they were pretty mini, and then I experienced one that was like, I don't know, like 4 minutes long or something. It was crazy. And I want to say that I've actually skipped taking tamoxifen like 3 times, accidentally of course. Like I get home and I'm so tired and I still kind of experience the heat throughout the day that are mini. I know that acupuncture works pretty good for that, so I would keep that in mind if, you know, if your hospital offers that. Another thing that they do say is coffee is not great for the hot flashes. I do want to say though, like these responses, these hot flashes that I was experiencing kind of went away. Like I don't really experience that anymore, and if I do, it's like more spread out. Sometimes I experience it in the night, which I will talk about, but for the most part, like I think, I'm not sure if it was tamoxifen, honestly. Like and over time I'll be able to tell you guys, of course. I think once the summer's over, I'd be able to tell a little bit better, but like not gonna lie, I'm so impressed with my body. What about mood swings? I feel like I think I do have a little bit of mood swings. I try to be conscious just because like after your experience you feel a little bit different and you feel differently about life for the most part. I do think I have mood swings though. Like I just want to be alone. Like I feel like I'm not a morning person. I'm kind of like a night person, but like I don't want people to talk to me in the morning and I'd prefer to be alone. I don't know, like is that COVID or is that like tamoxifen? Nothing crazy, you know? It's not like 1 minute, I don't know, like at least like in my head I experience it, and it's nothing crazy where I just like say it out loud. It's like a little bit more irritation, but most of it is mental and very controlled. I don't That's what I've experienced 2 months in. So another thing that I was so scared of, because I'm just such a workaholic, like today I'm gonna film 2 videos, I work 40 hours and then I do this on the side, you know, and edit for like 12 hours each week. I've also been on TikTok, by the way, how funny. I've been on TikTok and surprisingly, it's kind of going really good. Oh, and then like working out, of course, and everything like that. I don't think I've hit a depression state at all. If anything, the only depression state I've ever had was once I learned that I had cancer. So far, so good. One of the things that I definitely have noticed, every morning when I wake up, I always have to drink some water. Like, I have to chug water all day. This is something that they tell you to do anyway, but like, I feel like I wake up dehydrated for sure. Let me know in the comments if that's something that you guys experience. Okay, so insomnia. Before all of this, I could sleep anywhere. For the most part, it's been exactly the same. I take my medication at night, by the way, because you can either take it in the morning or take it at night. I feel like at night, I'd rather deal with like night sweats as a possibility versus fatigue throughout the day, right? If you take it in the morning as a possibility. Sometimes I have a little bit of trouble falling asleep, but it's never like I'm awake at like 10 in the morning. Sorry, 3 in the morning. For the most part, it's been pretty good. I will say though that I do have noticed, I think like twice, I wake up and I'll be hot for a little bit, but I'm still able to go to sleep. I actually have like really good sheets for that. They're like eucalyptus sheets. I do remember I watched a video and these women that were on Tamoxifen talked about how they got some sort of cooling water mattress that helps you fall asleep and regulate temperatures when you're asleep. I'll try to link the video in the bottom. Okay, so like if my family's watching this and this is gonna get a little awkward, I'm gonna talk about libido and whether or not it's dry down there. Okay, so libido, I am single. Honestly, I'm not too much of a sexual person. I don't think that that's changed too much. Perhaps if I was in a relationship, I would be able to give you more information on that. Am I experiencing dryness? Not really. Honestly, I feel like it's maybe like a little bit, but nothing noticeable. As far as fatigue, I do feel like some days I just like, after work, I just stay in bed the whole day. I kind of did that before, but like sometimes I do find it a challenge to just keep hustling on my side hustles like this on my downtime, but luckily I do have days off like today. As far as bone pain, I was so aware of my body before I took the medication because I wanted to see like what will I feel like difference or whatever. Before I took Tamoxifen, I was actually experiencing like kind of like a sharp pain on the tail end of my spine. It was like kind of painful, but it might have just been where I was sleeping when I was like, because I was sleeping on my sister's couch for like 3 months, and I still felt that. And when I was taking Tamoxifen, so when I had my own bed and blah blah blah, I think that working out definitely helps with that kind of pain, even if it's not from Tamoxifen, if it's just from like getting older and etc etc. So I would suggest lifting weights. I was experiencing that before Tamoxifen, so, and I feel fine now, but I am pretty active, which I will talk about. Hair thinning, honestly, so I've been letting my hair grow out. If you watch my earlier videos, you guys will see that my hair was like this short or whatever. I have thin hair in general. There are products that you guys can take, but for the most part, I feel like everything is looking fine. That was such a big fear of mine too, because I already have thin hair, but luckily we're doing good. I think like over time we shall see. So weight gain, this is a big one, right? I don't know, because I had 3 surgeries in 1 year and 6 months. I had a lot of recovery, so I don't know, you guys. I have been working out, and I feel like I don't notice that much of a difference, but it does take a while for that to kind of kick in. I don't know. And then I started slacking with my working out for like 3 weeks. So that, I think long term we'll have to find out. I wanted to say that it's a little harder to stay toned, but maybe it's just because like I need to be working out 6 times a week. Definitely not blowing up though. I just feel like a little bit more fuller in the size that I naturally am. And another thing is, this is really common. It could affect your menstrual cycle. Having an irregular period or it staying exactly the same is both normal in Tamoxifen. So For everyone it's different. Mine has been exactly the same, honestly, and that's something that my oncologist was thinking. She's like, I think you're gonna do fine. I don't think it'll affect you, again, just because of my age. If it lasts you, you know, like 2 weeks instead of, you know, the 3 days that it is for most of women, that's horrible. And I hope that that's not you, but know that that is common. Obviously speak to your oncologist and your gyno, make sure that this is all normal, and you know, I'm not a doctor, you guys. And as far as like hunger linked to like weight gain, which I was talking about earlier, I don't know, you guys. I really don't know if it has affected my weight gain because, sorry, my hunger, because I do feel hungrier, but it's normally on the days that I work out. So I'm gonna link it to working out. Will I say that I've been working out as much as I would like to? No. Does the side effects of tamoxifen get worse over time or better? When I asked her that, she said, because I told her basically like women have sometimes said on the group chats that it does get worse over time or better over time. And she's just like, that's not like a really general rule. Like there's no like science behind that or anything like that. Typically it stays the same, but I do want to say, like, keep in mind for a lot of women, it does change over time. Maybe, you know, these side effects, you might not be experiencing them at all, and it'll stay like that for the next 5 years or 10 years that you take it, or vice versa, you experience so much side effects and it stays like that for the rest of the 5 years. And of course, and then it just might vary. Like you may start with a lot and then it goes down and then it comes back up. Hopefully that is not me either. And then lastly, I'm just going to talk about some advice that I have. I watched this one video because I was looking for like tamoxifen experience, and I found this one video of this girl talking about like her and her experience so far taking it. I will link it down below. Found this so helpful because I was so scared, you guys. I was so scared of taking this pill. And I remember she just like seemed so bubbly and smiling, and I was like, wow, if someone could be happy and going through all of this and on this pill that people say that you get depressed, irritated, and just, I don't know, like not wanting to get out of bed, experiencing fatigue and all of these things that sound so scary, and that can affect your, you know, can give you other cancers and can affect your life. But seeing someone smiling and talking about their experience through this, like that made me so cheerful. So anyway, I found her video. She had said that before, to put that fear aside, before she took her pill, she said, this is the happiness project. This is something along the lines of like, this will help cure my cancer or something like that, where you basically just, instead of like taking this pill out of fear, you know, you say something like along the lines of, this is gonna help me. I don't know if that made any sense. She said it a lot better than I did. The first times that I took it, I so scared. I looked up a meditation, a guided meditation on how to switch your mindset, and that's what I ended up doing. I meditated on the bottle before I took it, and then I started doing that for the first week, and I really found that helpful. So I think I would suggest that you guys do the same. I will give you guys another update in like a couple months. I'm going to be having my next surgery in a month-ish, and I'm going to be getting an areola. If you have no idea what I'm talking about as far as where I'm at with my cancer journey, I have a whole playlist, so you guys can go ahead and check that out. I post every Mondays, lifestyle, cancer, and everything in between. I will see you guys super duper soon.